COVID-19 is thought to spread mainly from person to person through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can lead in the mouth or nose of the people who are nearby or possibly be inhaled into the lungs. Additionally, spread can occur when droplets contaminate nearby surfaces and when touched can lead to self-inoculation when a person inadvertently touches their own mouth, nose, or eyes. General guidance for preventing COVID-19 transmission during CPR. While there is currently no specific data on COVID-19 transmission while performing CPR or giving first aid, it is reasonable to conclude that chest compressions have the potential to generate respiratory droplets or aerosols. Guidance for personal protective equipment. Performing CPR to COVID-19 patient, PPE is recommended by CDC. This would be wearing respiratory protection using N95 mask or disposable mask, eye protection, and disposable gloves if available. It is also recommended to place a face mask or any face coverings over the mouth and nose of the victims. Guidance for compression. Chest compressions and use of an AED is available is recommended. Whether or not a cardiac arrest victim is suspected of having COVID-19, 911 should be called, and if available, an AED should be used. Guidance for performing CPR. During COVID-19 outbreak, it is currently recommended that no rescue breaths be performed to patients with confirmed or suspected COVID-19 due to the risk of disease transmission. The following measures are recommended and may be associated with a decreased risk of transmitting the virus. First, when assessing for normal breathing, it is recommended that the CPR care provider looks for breathing but does not listen or feel for the victim's breathing, as this will minimize potential exposure. Second and last, it is recommended that victims receive continuous compression-only CPR until emergency personnel or an ambulance arrive.